If we prescribe one of these, it means it's indicated in your case, and watch this video for instructions how to use it properly. So we call this a cervical denneroll. This is indicated for patients with a loss of curve in their neck, as seen on your x-ray, or with what we call forward head posture up to about 2 inches. So if we've given you this, your problem indicates that this is one of the best things you can use to help hold your adjustments between your adjustments and to help restore that nice cervical curve we talked about. I'm going to show you how to use this properly to get the best results. I want you to remember that when we showed you how to do this in the office, the device was chosen for you based on your height, the flexibility in your neck, and also your x-ray dictates where the apex of the denneroll should be. So if you're unsure about that, then speak to me, ask me a question via email or at your next visit, and I'll be sure to help you with that. The great thing about this, it tells you shoulders this side, so we know that this will be pointing down to our feet. So don't mix it up and go backwards. It says shoulder side here. We want this edge pointing down to our feet. So one of the most important things using a unit like this, like the denneroll, is making sure you're properly getting on and off of it. So we want to do this very gentle and slow because it is quite an aggressive unit, and we definitely don't want to injure ourselves doing this. So Suzanne, can you just lie down and just show people how you do that? So you're going to slide the shoulder side down to the position we've shown you in the office based on your x-ray. And we're going to make sure that the head is extended over the top with the head pulling and using that as leverage or weight to help create that curve. It's opening up the disc spaces here. It's stretching at the ligament, kind of like that retainer we talked about. Very comfortable position. To make it a little more difficult or more aggressive in terms of traction, you can straighten your legs out. And this just adds a little bit of a dimension. Some people will not be able to take this. So if you can't, then that's fine. Leave the legs bent. The other thing we want to make sure of is the surface. We want to make sure that we're on a fairly firm surface. We have a chiropractic table here. Obviously, most people won't have this in their home. But using the floor or a carpet on the floor would be great. What we don't want you to use is your bed because you will sink into the bed and it'll take away the traction element of the denneroll itself. So you can see the neck is curved over top of the denneroll. It's in a very relaxed, comfortable position, and this is the ideal position to get the maximum effects of the traction. So when you've been on it for your prescribed amount of time and the position's been correct, the next most important thing is how do you get off this without irritating your neck? And there's a few different strategies, but a very simple one is just making sure you're being very slow and specific. So you want to bring the knees up, and then you want to pull the traction unit out from the side, and then you want to roll your body over, and then you want to sit up. That's it. Piece of cake. So how frequently should you use this? And the ideal answer is daily. Now, that might not be realistic for people, so our goal in our office is to get people to use this at least 5 days per week. If we've shown you how to use it and we've shown you the placement, then for some of you, we will have gone through an increase of 1 minute a day. But for most of you, we'll actually say the increase in time on this would be 1 to 2 minutes per week. So you would do it for 3 minutes, say, for a whole week. And then the next week, you'd add a minute or two and do it for 4 to 5 minutes through the week, and then continue to add a minute or two each week, up to a maximum time of 15 minutes. So now that you know how to use your denneroll, the most important thing is that you do it as consistently as you possibly can. The more you use it, the better your correction, the longer your adjustments hold, and the happier you'll be. As always, I hope you've enjoyed this video. If you have questions or concerns about whether you're using it properly, if you're a little sore, then please reach out to me. Please ask me at your next visit or send me an email. Until next time, be well.